Good evening, all of you. Let us begin our webinar from novice to expert veterinary practitioner. I welcome all of you in this to this August evening. First of all, I welcome Dr. Uday Kumar. He is at US. Dr. Uday Kumar, he was my classmate, and he is a leading veterinary small animal practitioner at Florida. I extend a warm welcome to Dr. Uday Kumar on behalf of Kalnadi Velanmai and Peru Foundation. I welcome Dr. Arun. He is not specialized in the MBSc and PhD. He did non-clinical subject. He proves that to become a novice veterinary practitioner, it need not be specialized in clinic. Basic BBSc specialization with updating with the knowledge with the training, enough training is enough to acquire all the skills, and he can bloom in the practice. He is such a successful veterinarian. That's why I invited him to preside this webinar on novice expert veterinary practitioner. Dr. Varun, I welcome you on behalf of Kalnadi Velanmai and Peru Foundation. And welcome all the participants. I think more than 1,100, nearly 200 participants has registered, and now they are slowly joining. You all aware that our practitioners always in the emergencies and other things. I hope they will come and join. Once again, I welcome all the veterinarians, practicing veterinarians. Some of the practitioners from not only from Tamil Nadu, they are from other states of India. From India also they have registered. I welcome all of them to this webinar. Why I propose this topic, we commonly discuss veterinarians in the SAPAC and other college and other training program. They used to select some subjects, diseases, and the various dimensions of diseases, and the list of practices or approaches they used to discuss. But this topic, apart from knowing about the diseases and the treatment techniques, the overall approach to become an expert veterinary practitioner is essential. That needs a veterinarian to acquire various attributes. I hope this topic will be interesting for you to become an expert veterinary practitioner. I once again welcome our overseas guest, Dr. Uday Kumar, my classmate, and Dr. Gomadanayagam, the joint editor of the co-editor of the Kalnadi Velanmai. He is MC of this meeting. I welcome Dr. Gomadanayagam to introduce Dr. Varun.
Thank you, Madhi. It's a good idea to start the webinar for veterinarians after for Doctor's Day. That's July 1st, it was celebrated. So I'm very happy to introduce my colleague, Dr. Arun, who has completed his UG BBSc program in 1999 and completed a PhD in non-clinical subjects. But before venturing into practice, he has undergone many international training to get knowledge on small animal practice, and he started his private practice, and he opened up his clinic in Chennai in the name of SKS Veterinary Hospital in 2003. He actually completed a UG in 99 and started his venture in 2003. Then completed with the practice, he has undergone MESc and PhDs, and he has completed a PhD in 2010 in animal biotechnology. Now he is a very, very successful veterinarian, even though he is from a non-clinical practice, but he has got a very good knowledge in small animal practice through various international trainings he has undergone. He has taken up his own interest to join many programs, and he has got the skill now, and he has got 12 such clinic in various cities of Tamil Nadu as well as outside Tamil Nadu, and he has employed more than 112. Just now we are talking about him, so he has got about 112 employees under him working for the small animals, and he's a very, very successful practitioner. I welcome on behalf of the Kalanadai Velarmai, and I thank Dr. Madhialagan for thinking about this because he was actually talking to me last week that Kalanadai Velarmai should do not only the as a paper or as a this thing writing or something, it should reach the farmers through webinars, to reach the doctors, private practitioners and other things through by inviting speakers from outside. First one to join today is our friend Dr. Uday Kumar from Florida. Not Florida. Now he's in Tampa, is in Florida or Texas?
Yes, it's in Florida, Tampa, Florida.
Florida. Okay. He's in Florida. So very good friend of us from 83, 77 onwards probably. And we used to keep talking to him. First, we will invite our special guest of our chief guest, Dr. Arun, to have share his experience first. So that others who has joined as a new practitioner in this field can get some experience from your this thing. I invite Dr. Arun. Please share some of your experiences, how you established yourself in the field. Okay, we like to hear from you, Doctor. Thank you for the opportunity.
Thank you, sir. Thank you, sir. Sir, thank you for the opportunity, sir. Sir, Madhialagan sir and Gomadhi Nayam sir, all are a teacher. In fact, you are in Namakkal, sir. But I have very good faith and respect on you, sir.
Thank you.
Here, actually, I prepared small PowerPoint, sir. Can I share, sir?
Definitely, you can share.
But you have to give permission, sir.
Yeah. Adya?
Please proceed.
Proceed.
Only one request.
Yeah.
Mute. Adya, mute. Unmute.
Yes, I request all the participants, Dr. P.S. Venkatesan, Ramesh Ramasamy, Sendil Selvan, Anand, Perumal, Saravanan, Kishore, and Saktivel, and Rahul. Please open your video because you are seeing our guest face. We would like to see you also. Please open your video and attend the meeting. Doctor, you please proceed.
Sir, yes, sir. Just here I am just sharing very few points about how we choose and why should we choose a penicillin. Maybe I don't know how much it will going to help, but it's my view. Just I sharing here, sir. So mostly private practice. In the three ways, either small animal practice or large animal practice or mixed practice. In the small animal practice, always will be good in metro cities. Then tier 2 city, it's very good, but mixed practice will be very good. In case if it is village, it's a better large animal practice. Sorry, now I think. So most of the time, what our common scenario, Once we completed our BVSC, most of us will think for MUSC or PhD or in the research side. One of our group will always think about the job, VAS, dairy or poultry industry or competitive exam or pharma industry. All of us will think as a private practice as a part-time, just to do a vaccination program or deworming or like that. Generally, why we are not full-time practice, why we are not taking, most of the time what I am thinking, most of the time lack of awareness about the private practice. We always think about some job, either VAS, assistant professor or AWIN or any other research title job. Then I used to say lack of confidence. We always feel, or our friend, our parent used to say always, get a good secure job. We'll think VAS, assistant professor as a secure job. Private practice is always the secondary job, supplementary job. Lack of presenting ourselves to the society, it's mostly comes under confidence, lack of confidence. Then lack of knowledge. Here I'm not saying about our scientific knowledge. Here we don't know what we want to be or what we have to be, like that. That is I'm saying as a knowledge. And last I'm saying the comfortable zone. Always we want to spend much time on TV, social media. We want to spend much time on that. So we want to work lesser in our work. So in fact, phone, social media, TV, it made us to lose our thinking ability. It made us not to think about ourselves. So it will keep us want to stay in the comfortable zone. So please come out. So it's mostly youngsters for us, or for, I mean, the next coming generation. This is very, very important, sir. Mostly full-time practice. What is the big problem? We have to work more time, more responsibility, more risk. That too, customer will expect from us behavior, nutrition, veterinary science, everything they will ask from us. So we need to upgrade our knowledge in all the area. Same way, we should know good communication. Then only communication and relationship very, very important. Then only we can able to have the relationship with the customer. Then another very thing, everyone have doubt about our private practice, potential about the practice. But if we are tapping that private practice, we are the king in this profession. I want to say everyone, this earth is filled with lots and lots of resources and opportunity to everyone get a better life. So we are not confident with this, but it's a fact, it's a true. I want to change now, practice profession become industry. Everyone want to start the practice. Even non-vet also they want to start a practice. In general, pet population day by day it's started increasing, especially after COVID period. It's a doubled or tripled. Those who are buying or adopting percentage is very high. In 2013 and 20, the CAGR, the compound annual growth rate is 17%, whereas expected 2021 to 26 is almost 32.11%, whereas it's same in USA, it's a 6 to 8%. So especially India, it's a budding industry or a very, very nascent stage. We have very good potential to grow. We have so much opportunity to grow. It's a very simple pet grooming industry. 2007, it's a 132 crore. But now almost more than 1,000 crore. Everywhere pet spa, pet grooming center, blah, blah, it started too much. But unfortunate, everything by non-vet, not by the vet. What is the specialty in pet practice? Most of the area, say what I say, either pharma or poultry industry, wherever you want to go, we want to go for a job, we are ruled by the non-vet or some corporate. Only our small animal practice or private practice, we only dominate. As a vet, we only dominated. In the field of treatment, in the field of health sector, the veterinarian is the prime. We are the king. So that's a very, very important in the specialty in our practice. We don't have much competition, very, very less competition. We have more space to work. If we have very good interest, involvement, dedication, we can do wonders in our private practice. So we can very easily implement our knowledge. we'll get very good people relationship. We'll get so many people contact relationship. Same way, the major difference between full and part-time, in the full-time practice, you can do much work, much diagnosis, we can treat, follow up, everything easy. As a part-time, we need to depend on others. Area of pet practice. Generally, the treatment alone, not our area. We have so much pet nutrition, pet practitioner, pet behavior, pet walking, pet economics, pet snacks, tailor-made pet food, like pet sports medicine. Now the field is growing up. Still, we are waiting or standing in the vaccine or grooming area only. There is so much is now expanding our profession. So we need to catch up as an early bird. Say now slowly the corporate started entering into our area. Tata, he started in Mumbai. Apollo is planning. DLF already started. Kavincare started. So much corporate started entering into our profession. As a vet, why not we? So that's why I'm not predicted like that, but we started in 2003. I clearly said I want only private practice. I don't want any government job. So Dr. Sujata, the famous writer at that time, he opened, he supported me, he interested. Then slowly in the 2010, this is our small team. But now in the 2022, almost 11 branches in Tamil Nadu, 2 in Bangalore. Soon we are opening in Hyderabad and Calcutta. 22 full-time vet and 6 part-time or consultant vet, 28 vets. I think we are the biggest private firm having are given opportunity, or as a team, more veterinarians are working in the same umbrella. So 80 plus other than vet employees are there. So we have state-of-the-art facility like IDEX, Exigo, CR, DR, color Doppler, Doppler PP, everything we introduce. So especially in Chennai, our college have so much facility. Same way we want to develop the facility. Moreover, we want to give nook and corner the support to the customer or fulfill the pet needs. Same way within us, we started slowly creating one doctor with a specialization on soft tissue, the another vet for orthopedic, internal medicine, thereby each one having specialization area. So we can put all together in knowledge, we'll give better treatment or better health care for the pet. That's our idea. These are small our practice pictures, our team photos. We have very important nowadays, it's picking up pet water treadmill and swimming therapy pools to give more muscle strength, especially for hip dysplasia cases and neurological cases. It's very, very helpful. It's slowly picking up. This is our Bangalore branch. We used to say in all our team, pet care is not a profession, it's our passion. So because if you have good passion, you can do wonders here. Say for the newcomer or new starter, as India, now we have slowly documentation also very, very important. So just a few points I want to insist, what are the documentation we need. Now the pollution board is very clear, we need to consent for the start up the hospital or small clinic also very, very, very important. Pollution board clearance for the especially bio-waste disposal. We should not dispose our medicine waste or blood, everything. There are each town, they have some bio-waste disposable company. We need to have agreement with them. We need to pay every month. We need to dispose properly through that company only. We should not do other than that. So we need to update IVC and state board registration. Drug license, very, very important. Even in the clinic, the authority nowadays expecting drug license, otherwise they will seize all the drugs. If you are doing only one-man practice, you can keep all the drug in your cupboard or drawer. You can do without the drug license. Otherwise, it's a must. Then fourth, the trader license. If you are dispensing or selling any pet food or anything, trader license also very, very important. GST registration must. Then if it is a bigger setup, fire safety clearance also important. So new Indian Veterinary Council norms going to implement soon. Of course, they already formed. If this comes, even that norms gives very clear statement, what is the clinic, what is the polyclinic, what is the hospital, what all the infrastructure must be there. Like that, they created very beautifully, but very tough because it's very big rules and regulation. Slowly we will implement, then only our practice will be in good standard. Then I want to say very few points for the good opportunity. What is the good practice to improve ourselves? Other than good practice, we can't able to improve ourselves. Before starting a practice, we must do small statistics. What is the pet population? What is the paying capacity of the pet parents? What is the potential? What the pet parents expecting in this area? Like that, we need to do small statistics. Then we need to plan what type of practice we can go, either small or medium or big hospital, or what all the facility we must include in that. Then only we can able to match out. Please complete all the documentation. Do proper GST and tax. But because most of us will feel we should not, we are thinking it's paying GST and tax is waste. But according to me, we did properly GST and tax filing. That's why we can able to grow nicely wherever we want, wherever we are. It's very important, GST and the tax filing, according to me. Then another point I want to say, treat by heart. Always we should treat the animal by heart. Don't think about the money. Money is the secondary product of the treatment. It has to come following us. Don't focus the money and the treatment, then you lose the priority, you lose the healing. Same, don't comment ours or other vet. Please, because only in the veterinary practice, we are seeing many of us commenting the other vet or others prescription. Don't do that. Same way, we should not encourage such a customer. They will say sometime that doctor is very bad, sir. That doctor is doing this, that treatment is not good. Don't encourage that customer, because same customer, he will say about us also. Don't encourage. Even if it is blunder mistake, also say that is according to their point. We'll have our word. We are strictly following this. In case unknown case or we don't know, then better say we don't know. We'll try to refer to the other thing. Very important, a referral. We need to refer in case if we don't have the facility or if we don't have the knowledge. Don't try without our knowledge or facility. Finally, I want to insist, because this only helps us to grow, continuously upgrade our knowledge. We need to upgrade it daily, day by day. Then only we can able to survive in the private industry, because the new coming vets or youngsters, they have more knowledge because of their curriculum is upgrading every year. So as a little old practitioner, we need to upgrade. Then only we can able to meet out the good practice. So if we are doing such a thing, bright future is ready for every one of us. I think I said few points about our practice, sir. Sir?
Okay. Thank you. Very nice. Very nice. Already, I think you have got a PhD in practice also. Very good knowledge and other things. It's very happy to hear from you, and it is a very you are guiding force for the youngsters. What are the challenges you are undergone and other things, and how you have established now, and how to do conscious practice and other things. And it is very important to keep ourselves updated, because as you told, even our clients also will be in the internet. They are seeking actually everything is so it's very important, and you have done a wonderful job, and it's a very proud moment for your teachers also. He's a very so you have to guide many of our youngsters, and many of the youngsters now here very easily you can take up this practice as a full-time practice. Jobs are going to be very dear in future, very dear. No, even though many colleges have come up, jobs are not coming up. So many vets, graduates have to depend on the practice only, and it should be a healthy competition, right? As you told. So everyone, we should share our knowledge and do it. Thank you for
Okay.
your time, Doctor. Thank you. Very nice introduction to this webinar. Now, our friend Dr. Uday Kumar, actually, he is started as a VAS, not as a Dr. Arun said. He has not gone to that side. He has started as a VAS. 6 months started. He is in Hero Dairy. Then he has joined the Animal Husbandry Department. At that time, in 1983, we were given job even before we have completed our course. So we were. I remember still, we were about 117 students passed out, graduates. There were 400 jobs waiting for us, VS job, and many of us have gone directly to the VS job. But even though this gentleman, he has gone to Erode Dairy for 6 months, then he has joined as VS in Tirunelveli district, and he has worked in near Sangran Koil area. Then he has gone to the EOH, the Panchayat Union. At that time, we were given the job of extension officers in the Panchayat Union office. So at that time, it was actually we were fighting for that post during our graduate time. Is it? You remember Uday Kumar, 1980? We were all put under bar, no, behind the bar. Yeah. So that time we got fought and we got about 384 posts. So he has taken up the EOH post in the Panchayat Union. Then he has gone to Trichy as VAS, police station VAS. Then suddenly from 91, as Madhilagan and myself joined the college, maybe you would have thought it is not his place to stay back. So he took up to the molecular biology in Montana State University, Michigan State University. Right? I'm right? MSU.
Montana State
Then
University. Montana.
Yeah?
Montana State University.
Montana State. Yeah.
Molecular
So he worked there, and he has the 19 Florida. He did clinical rotation because it is not very easy to get a private practice license in US unless you have the DVM. Now with his BVSC, he has done a clinical rotation in Florida State, and he got licensed to practice in the year 1999 itself. Now it is almost 22 years is in the practice, and he has established his clinic in 2001, and he is a very, very busy veterinarian. He does a lot of surgeries daily, and we are lucky to have his time today because I know that he is in the early morning. Now it's almost 7 o'clock, I feel, no, morning 7:15. So he was here. He is here to share his experience, things that he has got a rich experience both in the academic side as well as so he has combined his academic knowledge with his practice, and he is doing it. So very welcome, warm welcome, and we are thankful on behalf of the Kalanadai Velanmai. I thank Uday Kumar for giving us time to share his topic, novel topic, novice to a successful veterinarian. So he has chosen his own topic. He is well versed in a conversation. So hope we are expecting a good share of knowledge from him. So I invite now Uday Kumar to talk on this topic.
Hello?
Hello?
Can everybody hear me? Can you all hear me? Yeah. Good afternoon. Thank you, Dr. Govindanagam, for such a nice introduction. And thanks to Kalanadai Velanmai for doing this, for arranging this. And I'm very grateful to Dr. Madhilagan for starting this and inviting me to talk. Thank you very much. I'm very happy to meet Dr. Arun, such a great practitioner with so many hospitals throughout the country. I wish you well. I'm sure you will do very well and you'll keep growing. Now we'll go to the topic, from novice to expert veterinary practitioner. I already an expert veterinarian. Dr. Arun has given a good deal of information about this. I'll try to add some more. This is actually a very general topic, as you know. It's not very specific, like about one disease. So some of you might get some information that you need and it might help. For some, like Dr. Arun, he himself is a great expert in starting hospitals and running hospitals. I like the way he said, treat from your heart. Money will come automatically, you know. So with that, I'll go into the slides. Okay, share screen. Are you able to see my slides?
Yes.
Okay.
Yes. Put in
Yeah.
slide.
Yeah. Okay.
Yes.
Novice to expert veterinary practitioner. I searched on the internet about this topic. If any veterinarian has written anything or not, there's nothing. But the nurse practitioner, they have written a book about how to become this. And I'm going to share a few slides about who's novice and who's expert and what is in between. So, but we won't spend too much time on that. We'll just rush through those slides. So there are 5 stages: novice, advanced beginner, competent, proficient, and expert. We'll see who fits in those stages. Stage 1. When it is novice, that means they're the first year clinical student, not first year BVSC student, first year clinical student. They've already studied some subjects like anatomy and physiology. But they're interested in looking at the animal and how, what's the diagnosis, what's the treatment. But they're very much interested, but they don't know much about veterinary medicine. That's a novice. Okay, the advanced beginner. They're new grads. After graduating from college, they got a lot of knowledge in their head. But when you give them an animal to treat, they'll have a lot of time understanding. Some of them it varies. Some people would have actually gained a lot of knowledge and worked with professors, even gone out in the field and worked with them. They will know. But otherwise, as soon as you graduate, you're going to, like, every disease. If there's a cough, you'll think of everything that's possible. All the differential diagnoses will come into your mind. You don't know how to channel your thoughts and analyze and make a diagnosis and treatment. Next one. Competent. This is after a few years of practice. They're doctors, they can treat. But after a couple of years, still they will have doubts. If there's the new case comes, they're not sure. Should I do this? Do they do that? That kind of little bit confusion will still be there. And proficient practitioners are after a few years, they are good practitioners, but still they will need to think a lot. They will need to analyze. They will need to do many tests. But an expert veterinarian who is one, everybody will have doubts. Okay, I'm not saying expert knows everything. I'm not talking about a specialist. I'm not internal medicine or surgery or things like that. A general practitioner who has worked in the field as an expert, like Dr. Arun said, everybody will have doubts, and one way or another, one time or another, we have to refer to a specialist. We always do. So an expert will, as soon as the case comes, first of all, he or she will know whether they can treat this patient or not. Pretty soon, after 5-10 minutes, I can tell, I don't think I can fix this problem. You need to go to the specialist. But most of the time, I know I can fix it. And very, very quickly, within 5-10 minutes, I will be able to understand the case if I can treat it. If the animal comes with lateral recumbency, and they have no idea, I have no idea, then I tell them, I don't think we can fix this. You need to go see a specialist, because they need to do MRI and ultrasound. I don't have ultrasound. I have X-ray only. I will show some slides on that. But soon, I will be able to understand. I'm comparing myself to when Dr. Govindaram said, I started my own clinic in 2001. I started practicing in USA in 1999. At that time, I was working in mostly large animal practice in India, and then molecular biology research for 7 years. So as a small animal veterinarian, I had a lot of questions even after doing 1 year clinical rotation. So I'll have a lot of doubt. I'll read up. I'll always carry my pharmacology book to consult to get the dose. All those things. So compared to that of me, and now I'm a very different person. I still consult I'll still read. If I have a question, I'll go read the book. Even after sending them away, I will for doses. I still consult my book. But I'm very comfortable in making a decision and talking to the owners and comforting them, because they're like Dr. Arun said, they come to you with their questions and they worry about their pet, and with the way we comfort them, they'll get it. If you're not sure, they will know that you're not sure. So, but when I'm sure, and I say, don't worry, this is a minor problem, we can fix it. So I'll go to the next slide. So how do we develop skills to become an expert? Meaning you're a beginner, what do we do? You have to, I'll go one by one. We have to listen to a client. Especially in a small animal practice, the client spends a lot of time with the pet, and they know. I'll explain about this in a little bit. Be ready to learn from others, whether it is another doctor, senior doctor, or a new graduate doctor, or an assistant, an attendant, technician. They might have worked with a lot of other doctors, and they would tell you how the other doctor did, and you can easily get the knowledge. Observation, reading, like Dr. Arun said, you go back and read, and then go back to books also. You have to observe the animal as it comes in and take notes. Like I said, we can go on some of this. We can go back and expand. Listening to a client. I remember this case. I was working as an emergency veterinarian in Fort Lauderdale. An old lady came. It was in the night. Of course, after the rest of the hospitals are closed, that's when the emergency hospitals open. An old lady came, and her complaint was there's blood coming from the back end. So my technician brought this dog into the room. I was going to examine the dog, and the old lady suddenly, she almost like murmuring. She said, the girls at the hospital, the hospital said there's blood coming from the back end, but I think the blood is coming from the front end. I stopped and I asked her, why do you think the blood is coming from the front end, ma'am? Because she puts the head on the pillow and there's a little smear of blood. I see, I said. So this dog has already been treated by another veterinarian, and the technicians, they said that there's blood in the back end, and they've treated it. It's not going away. And the little dog, it was a small dog, I remember, puts the head on the pillow and there's a little smear. So I examined the head. I examined the jaw. I like here, the mandibular surfaces. There was a fracture before, and another veterinarian had fixed the fracture with the wire and twisted the wire and tried to push and put the skin over, but it was protruding beyond the skin, and that's why it was there. So I told her, you're very correct, ma'am. It's just a wire from the surgery. It's not healing. It doesn't heal that well because the skin is very thin there, and whenever it puts on something, it may bruise and open. Even though I couldn't say, it will be okay pretty soon, because after the surgery, after the bone is healed, they got to take the wire out. Only then we can say it will not happen again. But at least we found the problem. So listen to your client, not only for this. If they come for one thing, and if you treat another problem, then you have to tell them why. Sometimes I do. Sometimes the client says, he's itching a lot, doctor. Then when we examine, we see the ear infection. He has got a very bad ear infection also. We have to treat that. Sometimes the dog has a heartburn. He doesn't even know. So we have to listen to the client, but at the same time, we have to do our examination and proceed logically. Be ready to learn from others. I put this thing here, because I learned this from a technician. Again, I was working in the emergency hospital, and this cat had fluid in the thorax, had very difficult time breathing, and did not eat because he's trying to breathe all the time. There's so much fluid in the chest cavity, the lung is not able to expand. So I said, I can put a butterfly catheter in and take the fluid out, but we need a three-way cork. It's on the right end. You need the little blue and yellow thing you can on the slide. I need a three-way cork. I don't know how to do without it. My technician said, my other veterinarian does. He simply clamps into the artery forceps, the curved instrument. I said, oh, okay, that's good. So because if you draw the fluid from the thoracic cavity, and then if you want to dump it, empty the syringe. If you take the syringe away, it's going to suck air because there's negative pressure. So you got to close it. Just clamping it, a simple thing like that. I learned it from her. Actually, I'll tell you another thing that I learned from a couple of more things that I learned from other technicians. I was working again at the emergency clinic, and I was thinking of starting my own clinic. And the guy said, the technician said, doctor, if you go to any veterinary hospital, the doctor would have finished treatment, but you will see the client waiting for another half an hour or even 45 minutes because you give the list of items that you did for this pet, and the tech secretary has to put everything in the computer slowly, and it takes time, 5-10 minutes for each client. And if you send 2-3 people, they're going to wait. So I asked him, what do you think? What's the way to solve this? He said, give handwritten invoice. And how do you do that? He said, you need to give one to them. You need at least one copy for you. So the way you do it is, he said, you can, without carbon, you can make 2 copies. Just handwrite it, or ask your secretary to quickly write it. You can write it in a minute, less than a minute. Because already I'll show you. Already you can put the common items in the list, and quickly write it and get this alarm. Are you able to see? It's got 3 copies actually. I'm using it for more than 20 years. It's got all the main important things that I give. If there's things that doesn't have it on the list, I write it by hand. Only thing we have to do is put the amount and total it. It may seem very simple. Actually, it has saved a lot of time, because in veterinary hospitals, they'll say, a feast or famine. Suddenly, everybody will come, 5-10 people will come, and a few hours later, nobody will be there. So the secretary will have time to put this in the computer later on. It was a very important thing that I learned. So that's what I mean by be ready to learn from others. That's the form I have. See, it has got all the things that we normally do. Another thing is, I was as a UAS. One day we went to reduce a prolapse, uterine prolapse. And again, I was like 1 or 2 years into the practice. I didn't know how, in the veterinary hospitals in the college, they will have a rubber sheet where they will, after you wash the uterus, they'll place this rubber sheet to keep it clean. I know how to reduce the prolapse. You need a very delicate hand, but the hospital, we didn't have that. And I was telling my attendant, what do we do, man? He said, at the time, plastic paper bags were not available like this. You're polluting the environment now, but at the time, there was no such thing. He said, we can go to this shop and can ask them to give the candy bag. Will he give it? He will need it. He said, if you ask, we'll give it. He'll put it in some other bag or something, and he'll give you. That's what we did. I learned everything from little things from other people. So again, when I bought the hospital from a Korean veterinarian, he had all these forms. There are many forms. This is the first one. The blue one on the left is the form that we give them to write their information. The middle one, the green, is for dogs. For cats, it's yellow. So as soon as I see the paper, I know, okay, we are seeing a cat or a dog So all this I learned from others. These are other forms, euthanasia form and surgery form, right? So other ways to improve your skills. One of the things I did was I went and volunteered at the Humane Society for 2 to 3 weeks. There's a lot of spay and neuter to be done there. So when I went there and asked, they readily gave me a chance. So I would do like 15, 20, 30 spays and neuters, both dogs and cats every day. I learned a lot because then I become very proficient. I don't have any hesitation about opening the abdomen or doing any incision and doing a surgery. I was always interested in surgeries, but I had not got much training in doing surgeries, especially small animal. I've even done C-sections in cows and buffaloes in India as a VAS. But to be able to do every day, without any hesitation, like being an expert almost, not a specialist, surgery specialist, but without any hesitation, I can put any animal under anesthesia and start cutting and opening and fixing things. So volunteering my time as a veterinarian to do space and neuters helped me a lot. The other thing you can do is, like Dr. Arun said, you have to keep on learning. One of the ways is continuing education classes, just like this one, or arranged, by experts, by universities. You can attend that, and even WhatsApp. WhatsApp helps a lot. WhatsApp. A couple of days ago, I saw a WhatsApp case of a ear hematoma, oral hematoma. I want to put that small video. Adiaman, can you please load that video for me, please? This one. Can you put this one? Adiaman?
Hello, uncle.
Can you upload the video, the short video, please? Or I can do it. Yeah. It's a ear hematoma surgery. They're doing it in Dindigul. Okay, thank you. We'll come back. Wake up at clinic in Dindigul. So Buster hematoma compass is what they use. I've never seen this. The reason I wanted to show this is, you can learn from the internet also, from WhatsApp. I've done a lot of ear hematomas. I don't do it this way. I remember the first time I saw ear hematoma surgery done by Dr. T.N. Ganesh when we were in like fourth year or something. I remember that I still use the same technique. But this seems new. I don't know how this is better or not. But you can always learn from the internet and things like that, no? So yeah, and then like they said, go back to the books. Even if there's a difficult case, then by all means, are you able to see me? Are you able to see me?
Yes.
Yeah, and you're able to see the slides? Hello?
Slide
No, not able to
there
see.
here.
Oh, not yet? Oh, okay.
Yeah. Slides not shared.
Okay, okay. Because, okay, we switched. Okay. Share screen. Okay,
Yes.
you're here.
Make it to full screen.
Okay.
Yeah.
So we'll move on. See, when you're an expert, I'm not all saying as a specialist. Okay, when you're proficient, when you know what you're doing, a dog comes as cough. Cough can be due to many reasons. How do we quickly say, how do I want to treat? How do we make a diagnosis, and how do you want to treat? So cough could be pulmonary or cardiac. So this could be the lung problem, or it could be a cardiac problem, like a heart murmur. If it's a lung problem, it could be respiratory infection or inflammatory airways or collapsed trachea. If you have observed, that's why I said you observe the dog as it coughs, you might be able to tell some of these things. And of course, you have to always do a full exam. Full exam from tip of the nose to the tip of the tail. You have to. It doesn't take a lot of time. You can do it in a few minutes. Routinely. Look at the eyes, look at the ears, listen to the heart, listen to the lung, palpate the abdomen, spinal examination. If the dog is happy, jumping around, running, you don't need to do a spinal palpation. But you need to know what to look for, which area you have to focus your attention on examining. But general thorough examination is always necessary. So you'll catch a heart murmur. So you should also ask the history. History, like I said, listen to the client. Sometimes you'll have to ask them questions. Otherwise, they will forget. They will give things from their own point of view. And nowadays they have Google. They will say, oh, he's scratching, doctor. This is very bad. He's suffering. But they won't know that the dog has a heart murmur. Or how long has it been scratching? They will say 1 or 2 months. They'll come to you now after 1 or 2 months of scratching because there is another reason, because the dog stopped eating or the cat stopped eating. So you examine you examine the animal, and then you find that the cat has a blocked urinary bladder. He's not peeing. That is why he's not eating, not because of not scratching. So you have to tell the owner, hey, we know he's scratching a lot. He's got a lot of flea and allergy, but we have an emergency here. You got to unblock this urinary obstruction. Otherwise, your cat will die. I can give anything for the skin. The skin might get better or not, but before that, your pet might die. So that's why you have to do an examination. And like I said, when you see so many cases, you quickly know. Okay, you palpate and say, hey, this is what we need to do now. The scratching can wait. Like that, when there's panting. Panting can be from heat, just being in the sun too much. Pain, a lot of pain can do that also. Like it could be a respiratory problem, it can be an infection. So you have to quickly screen. You ask the client, did you be walking in the sun, or they themselves say he's been having some pain, or you take the temperature. If you have to do blood work, you do blood work. So use all these techniques, all this knowledge and observation. Like I said, look at the animal and see how it's panting. Sometimes, like I said, sometimes there could be multiple problems, and the owner will tell 1 or 2 problems. And like I said, they will wait. Some of the problems will have been going on for months even. The last minute they'll come, they'll say he's scratching, but they came because like I said, they came because he stopped eating. So like I said, that some of the problem could be life-threatening, like a blocked urinary bladder. That could be if you take a temperature, that'll be high. It could be high. There could be infection. Sometimes, like itching is a nuisance. I'm not saying we should not treat itching. We do. We treat itching all the time. But if the dog has a dog or cat has a blocked bladder and allergy, am I going to treat the allergic itching first or the blocked bladder first? I'm going to try to relieve the bladder first. So and there could be pain. Sometimes all of them in one patient because they waited. pain, and some of the problems, they're like a chronic problem, like ear infection. So as an expert, you have to decide which one you are going to do first. Sometimes, if there is a ear infection, and the scratching, you can address both. An antibiotic will help both of them. Of course, with the itching, you have to give some anti-inflammatory like steroid. But if there is a blocked bladder, I'm not going to give the steroid. I'm going to try to relieve that bladder first. Take an X-ray or pass a urinary catheter, or even if you don't have time, I'll say go to a specialist. There are more doctors because this needs an hour to solve the problem. So that's how you deal. Now you have multiple problems. You quickly list. This first, this comes second. This can wait. We will treat this next week. Also, there's minor itching, but there's the same dog will have vomiting, and there'll be skin problem. Well, I'll tell them. I'll try to treat the vomiting first, and then when the vomiting improves, let's give the steroid. Because if we give a steroid injection now, he may have a problem later on with this vomiting problem. Let's not make vomiting worse. Let's solve the problem. Because if you don't stop vomiting, again we are entering into a dangerous territory. That could be dehydration and death. Then your skin is no more available to treat. So first you have to treat the vomiting. So pretty much that's what it is. I will show a tour of my hospital and we can have questions. I'm sure Dr. Arun will be available to answer the questions also. That is the Oak Tree Animal Hospital in Tampa. That's my hospital. That's where I've been working in since 2001. And this is the front desk, the exam room, the reception area. You can see my secretary's head just above the table, the counter. This is one exam room 2. I got tables that can go up and down. You don't have to pick up. I can bring it down and walk the dog on the table and then bring it up. It also weighs. You can see on the blue square, the red, the digital numbers are the weight. It'll give me the weight, and that's a specimen cabinet there. This is exam room number 1, and the same. It's just on the other side. The cabinet with the specimen jars, I share both sides, and it's a glass thing. This is the surgery room. This is the pharmacy. I got medicines on other shelves also, and this is a kennel. This is the X-ray. We got a digital X-ray. This is a rat surgery that I did a couple of years ago. I took the rape to take the pictures, but actually I don't do. I do mainly only dogs and cats. That's where I'm proficient in. That's where I'm confident in. This rat belongs to one of my technician's brother, and they didn't want to go to another place. They wanted several $100. I charged like $100 or something. So I thought it was cool. Well, I'm happy to show this. Like I said, I'm not an expert or proficient in treating pocket pets. I don't have. I wish I could. I don't have the experience. Like I said, because I was working as a VAS and then as in research. I didn't have the time to develop more than dog and cat for knowledge in treating more than dogs and cats. With that, I will conclude. And if you have any questions, we will please ask the question. We'll talk about it. Is this?
Hello. Hello. Yeah.
Hello.
Yeah. It's a wonderful lecture by Dr. Uday Kumar. I just forgot to add some more qualities of Dr. Uday Kumar. He used to write a lot, both in Tamil and English. And one such book he has given me, I just still have. You know about Dr. K, the elephant doctor. He has narrated. He has given his book like thing in English version. That is Elephant Doctor, Yanai Doctor, like that he has given a book.
I translated the book. The story was written by Jayamohan. I translated into English.
Yeah. That's a good thing. And also he's also a poet. He's a sometimes he sings a lot. Many qualities are there. Apart from this, the busy professional side, he's a very good. He's very much interested in Tamil language and other things. Even though he is now very fluent English. Okay. Now we have two experts with us. One successful veterinarian from India and another successful veterinarian from abroad. So many veterinarians are here. So you can share, you can converse, you can have your doubts cleared from both the experts available here. I invite questions from the audience. And many of the times, we are not we cannot say to the client that we don't know this thing, that thing, or something like that. If any other than human beings, we have to be ready to treat. So in that sense, probably you are able to treat packet pets also. Any questions, Dr. Arun? Do you want to add any more thing? Do you want to add something?
No.
May I know how, Dr. Arun, from you?
Sir.
What is actually what kind of difference you observe from your own practice and his practice? Like.
No, actually, I mean, the major, maybe I don't think, sir. I mean, they are doing good, excellent, sir. Only what I felt, they have Pakka documentation system.
Yeah.
We don't have Pakka documentation system.
Okay.
Just we'll give prescription. We started writing in the prescription what is that. Please bring the next time. But even I took some photography of their bill and the primary case, secondary case, like the 3 sheets they showed to us.
Yeah.
They have very good documentation system. Same way, I mean, sir having the referring to other place. But what we are doing, we are calling the expert to our place. We will refer the case. That's the two thing I noticed.
I think I remember. Uday.
I'll just add to what Dr. Arun said. It is required by law here. You have to give a copy to the client if they ask for one. Yeah. They can go to any doctor anytime they want. But they can't ask you to give a record in the middle of the night. Whenever we are open, they can call and say, please give a copy, fax it to such number. We are supposed to do it. And it has to be documented. It has, even there's some state board exam, some inspector came and they're not veterinarians. They looked at my record and we were writing too fast. You have to write it more legibly, she commented. And she actually she told me, another doctor, his writing was so poor, he made him buy make the records in the computer, type everything in the computer. Only then he was allowed to come to practice because his writing was too bad, she said. So it is required by the law that we have everything documented and we keep it. There's like 3 years. For 3 years, if somebody came today and never came back, but they can call me in 2 years later, 2.5 years later, and say, I want a copy. I'm supposed to give it. And that's why I told we sort them by phone number.
Okay.
We put the phone number at the bottom of this record. Then we put them in the shelf according to the number, so we can easily get them. Yeah. That's all I just wanted to add. Why we keep records? We are supposed to.
Even college, we have the VMR section. Those days, nowadays, I don't think we have such a section is available. Veterinary medical record section. Then we have attended some days there during our internship program, like 1 or 2 days, like that. And we used to get usually for assignment or this thing, we used to take a lot of records from the section and used to write. Okay.
And also regarding referring, there are specialist hospitals. They won't. Most of them won't come. There are some mobile specialists. They will come, but they won't come right away. If the dog needs to be seen right away, then you got to send them to specialist hospitals. But the system here is, if you send them to a specialist, they will see only for the condition that you send them.
Mm-hmm.
Yeah, they won't do anything else. If they go directly to them also, they won't see the case. If you let's say today we have a internal medicine problem, I send them there and they treat. And then a month later, same dog or another dog has a different problem. They think they're going to go to the specialist directly. They won't see them. They say, you go to your primary doctor.
Oh.
Only when the primary doctors refer them, even by calling on the phone, they'll accept. Just to call, say, I'm sending so-and-so, please see this patient, they'll see. They won't try to steal the case. Like I said, they'll refuse to see without any referral. Any doctor, any general practitioner can refer, not just me. And they can go to another doctor, and then that doctor can send them to a specialist. So it is very streamlined and it is very honest. They're not trying to steal any clients. We are trying to do everything in the best interest of the patient and the client. That's all we do this. So, and if they go for one surgery, let's say the dog had a fracture, and I say, go to Dr. So-and-so and get this fixed. And there's some small mass on the side, and the owner says, can you take this also while he's under? The doctor won't do it. At the best, they'll say, okay, you call him, you call your doctor, and if I say yes, go ahead and do it, then sometimes they'll call me. The client wants us to remove this other little mass also while he's under. Do you want us to do it, doctor, or do you want to do it? Exactly, that's what they asked me. I said, if he's under and if they want to pay for it, go for it. Please take it. I never refuse. But some doctors will say, no, don't do it. I'll do it. Send them back here. So yeah, they will even when the dog is undergoing surgery, they won't do the other one also. They'll do only what we ask them to do. Yeah. Thank you.
One more question. Do you have pet insurance there?
Yeah, there is insurance. Not everybody has it. Maybe 10%, 20% of people will have pet insurance.
Mm-hmm.
Not everybody. In the human field here, insurance is a big thing, but the insurance companies make a lot of money, more than the doctors. They will refuse to pay and all that. So the veterinarians are behaving a little bit different. Nowadays, even if the pet has the insurance, we will bill the client only. We don't want to bill the insurance company.
Oh.
Then we'll help the client fill up the forms to get the money.
Oh.
Yeah. Because the insurance company will refuse to pay us.
Oh. But ultimately, you need to certify, no? You need to certify.
I don't know. But right now, right, they will bring the forms and we will fill it up, certify, like you said, certify. We'll fill out the forms and we'll put a signature. And this is what they came for on this day, and this is what the diagnosis was. It's not too much. It's like half a page only. The rest are the pages for the client to fill out. So we'll fill it out and give it to them, and they'll have to get the money from them.
That's nice. Any other questions?
Dr. Ramesh, please.
Sir, good evening, sir. Good evening.
Hello.
Sir, sorry, is I audible, sir?
Yeah.
I'm in field, sir. Came for a dystocia contortion. I'm from starting. I'm watching this, sir. Very nice lecture, sir. It's a great lecture. Many persons have missed it. sir, first to say about Dr. Arun's lecture, he highly, very correctly and basically narrated what are all the basic qualities for a successful and expert veterinarian to be a big practice. Sir, what he suggested, the first point is money. All the new generation or many vets are thinking that first you determine the money, after that go for practice. Like that, many persons are calculating, but this is very wrong. What Dr. Arun has rightly said, money should come after by heart practice. That's it. It comes from his heart. Really, sir, really, the money, the reference, and the comments. You should not comment on the others. That is the basic qualities needed for any person to be a successful veterinarian in the practice, sir. I really appreciate Dr. Arun's talk, and also he highly narrated how to start a clinic. Clinic in the sense that first you should have a survey over the area, he said, and also what to say, sir. He mentioned about what are the things to be done, what are the NOCs you have to get, like that. It's very nice, and he clearly mentioned how to proceed with the things. That's all. That is very useful, sir, for a good veterinarian. And actually, I'm Veterinary Council of India executive member, sir. Maybe many persons may be knowing. In that thing, I am saying that last 6 months back, Tata has called my president. During the time I was with him, and he asked about what are the standards of a clinic, what are the standards or what are the procedures to be followed to start a clinic in India, pet clinic in India. We don't have anything. After independence, so many years, still now veterinary is not prepared the minimum standards for veterinary practice. That is the stage, sir. During my previous tenure, we have formulated the minimum standards for veterinary education. That is for colleges and all. It is now following very excellently. It is implemented and all. Lately, we actually conducted 4 or 5 regional meetings throughout India, and we finalized the draft of minimum standard veterinary practice regulation. I think Dr. Arun has mentioned that, and that standards may be not maybe very high, sir, but it is high because our standard should be high. Standard should be high so that only we will go towards the standard. It has been circulated to the state governments, and after the state government, it has come, it is finalized. All the state government has accepted it. It is now in the draft in the coming week to the central government, and after that, it will be passed in parliament. After passed in parliament, 2 to 3 years will be given to all the state governments. After that, only based on the rules only, everything will be there, either from private or from government. This is for information. And Dr. Arun, Tata may come now to clinical practice, I can say. But in our point of view, Arun, all the audience are, you are the first Tata of original Indian pet practice. Really, I appreciate, Arun. You are the first Tata of original Indian pet practice. Because nobody has this, that much vision. Nobody has that much vision, sir. He is a very successful, I can, what to say that, like that. So due to, battery low, and also due to less time, I'm talking, sir. Maybe it's clear, sir. Its voice is clear. Yes, because sir. Only 1 or 2 point is there. And about our expert, the second lecture, sir. Sir, really, you highlighted many things needed for a person to go for successful practice. Especially what you have mentioned, sir. Listen to your client. That is the most important. Many persons have preconceived idea going to the practice, and after seeing, they are not listening the case from the farmers, farmer parents or pet parent, and just they'll have preconceived idea. They'll have some prefixed software 25 or 30 diseases. That the expert will have 25, 30. Others will have, and they go listen to your client. That is the first basic, very most point that you have mentioned very nicely, sir. And you told that be ready to learn from all. So it's a really great thing, and you are openly admitting that also. Sir, you are a very leading expert veterinary practitioner of US, the world of, first country. You told that you have learned something about oral hematoma from Dindigal. So really, it's a great thing. That is the thing. Every veterinarian, you have to learn from all, whether it is the pet parent or the client or somebody who is around you. All the four cardinal points are learn, be ready to learn, listen to your client, observe, go back to book. That is most important, sir. Many persons are throwing the books and they just Google and making WhatsApp and doing something. On the day, on that second, they completing and they forget. That you mentioned the take notes. Really highly valuable points, sir. Like that, you narrated very many things. The lecture was very for all the that too for entering practitioner. It is a very nice and needed lecture, sir. Sir, both Dr. Perumadi Ilagan sir and Gomathi Nayagam sir are my gurus and they are my teachers. Really, I thank both of them for given this opportunity to the field. I think in future many persons will join and they have missed this lecture. I think after this this will go into YouTube and it will be many persons will see this like that. Maybe there, sir. Due to less time, others have to speak. Thank you very much, sir. Thank you, sir. Sir, Perumadi Ilagan sir, and thank you, Gomathi Nayagam sir. Thank you, Dr. Arun, and thank you, sir. Uday Kumar sir. First time I am seeing you in this online, sir. Thank you, sir. Thank you.
Very nice feedback. Enthusiastic and interesting
Sorry,
feedback.
sir. I am in
Still you are
in field, sir. In informal dress in field.
Yes.
He's still in the
Having
field.
the quality of a practitioner, a practitioner should learn every day. You are having that quality. I appreciate you as a teacher. Thank you. Anybody else?
Yes, sir. Also, in my point of view, sir, actually, four cardinal, the same as you said. I can say while speaking to my students in coaching class and also to lecture, sir, four cardinal points I will say: proximity, availability, fees, and result. These are the four cardinal points in large animal or small animal. You should be proximity to the client and availability. And, opening a clinic or your I came to field is not. You should be available to the things. These both things important. The third thing is most persons are nowadays thinking that fees is main like that. What they are thinking that in government hospital, if you are not treating the animals, then the farmers will call for a good quality treatment to their house. Like that, they are thinking. They are thinking in the reverse way. It is very pathetic. It will go. So if you treat the animal by heart, as mentioned by Dr. Arun, in the government hospital, you will grow like any person. By seeing the result only, you will be judged. So today is a day after tomorrow. I'm going to Delhi. After 2 days, I will come here. My proximity is not there. My availability also very less. But still, all the persons are waiting for me to see the animal for all the treating cases. The thing is that only thing, the result will speak. No need of prescription, no need of popularity of phone number. I will do that thing, I will do this thing. And what many veterinarians thinking that if you are commenting on the others means they'll say, the farmer will say, they think like that, like you are the big practitioner. This is very wrong. What Dr. Arun and Dr. Uday sir, very, very nice talk, sir. Very basics of what to say, sir. Root. The plant will grow by its root. These are the root catchy points of a growing veterinarian, sir. Thank you very much, sir.
Anybody else have any questions or like to give your feedback, or otherwise let us close the meeting. Sivasankar Reddy is here.
I think he is trying to connect. Shiv Shankar was trying to connect.
Okay, otherwise I request Dr. Gomandanayam to propose vote of thanks.
Okay. It's wonderful to have all of you in the evening and listen to two experts with a different diversity and other things. And it might be very useful to the youngsters how to start to practice, what are the basics of practice, and what are the qualities a veterinarian should have, all those things. And I thank Dr. Arun for having spared his time to be with us to share his experience, how he has started and how he has grown and other things. And also Dr. Uday Kumar, in spite of his busy schedule, I think he has to go to office today. Today, you have an office today?
No, Sunday.
No,
Sunday. Today, Sunday close.
Okay, thank you. So he is very, very helpful in arranging these things. And I thank both the speakers, and also I thank Dr. Madhilagan for arranging for having thought of this and having arranged such things. And it is hope he is planning to continue every month also. For the cooperation from vets will support him. So I thank all of you who has joined in spite of their busy schedule. I know every one of you will be in the field or something, or somebody in the field. Dr. Manikavasam, so he's also in the field. So everybody is busy practitioners. So I thank all of you having spared your time and listened to the two experts. Thank you once again on behalf of Kalanadai Velanmai. Thank you once again.
Thank you, sir. Thank you, sir. Thank you.
டாக்டர் உதயகுமார், மிக்க நன்றி. இன்னைக்கு ஞாயிற்றுக்கிழமையிலே எங்களோட இருந்திருக்கு. நம்ம அந்த தாய்மானியனுடைய மக்கள் டாக்டர்ஸ்க்கு ஒரு நல்ல அருமையான நம்ம அனுபவத்தை ஷேர் பண்ணதுக்கு ரொம்ப மகிழ்ச்சி. டாக்டர் அருண் ஆல்சோ தேங்க்யூ டாக்டர் அருண். ஃபீட்பேக் டாக்டர் ரமேஷ், ரொம்ப நன்றி. டாக்டர் அருண் நான் அப்புறம் மறுபடியும் பேசுறேன். ரொம்ப நன்றி. Thank you very much.
And one more thing, Madhi. I request Dr. Arun and Dr. Uday to write something for Kalanadai Velanmai also, your experiences. We have a section, Namo the doctor. So some of your cases can be given to Dr. Madhilagan.
ஆமா, நம்ம கால்நடை வேளாண்மையில தொடர்ந்து நமது டாக்டர்னு ஒரு பகுதி வருது. அதுல இன்ட்ரெஸ்டிங்கான விவசாயிகளுக்கு பயன்படும்படியா, அதே மாதிரி அது விவசாயிகளுக்கு நீங்க அதை சொல்ற விஷயத்துல டாக்டர்ஸுக்கு இன்டெரக்டா அதுல ஒரு மெசேஜ் இருக்கு. இவங்க எப்படி அந்த மாதிரி அந்த கேஸ் அப்ரோச் பண்ணாங்க அப்படிங்கிறது. அது அந்த மாதிரி உங்க இன்ட்ரெஸ்டிங் கேசஸ உண்மையே உதயகுமார் ஒரு கேஸ் இங்க தமிழ்நாட்டுல ஒரு விஏஎஸ்ஆ இருந்து எப்படி அணுகினாரு அப்படிங்கிறத நம்ம அந்த புதிய பகுதியை தொடங்கின போது அவர் சொல்லியிருக்காரு. டாக்டர் அருணும் அந்த மாதிரி அவருடைய அனுபவத்தை ஒரு கேஸ் சொன்னாருன்னா எழுதுறோம். நம்ம அடுத்த கால்நடை
we can have it from Ramesh. Many doctors are here. Dr. Gopinath, Aravindan, Dr. Anita இருக்காங்க, சக்திவேல் இருக்காங்க. So all of them can send their experience, share the experience through Kalanadai Velanmai. We welcome all your experiences.
இந்த கேஸ் இதை நீங்க ஒரு வாய்ஸ் ஆடியோ மெசேஜா எனக்கோ டாக்டர் கோமதநாயகத்துக்கோ கூட அனுப்புவீங்க. டாக்டர் ரமேஷும் முன்னாடி ஒரு அருமையான ஒரு ஃபார்மரை அவர் போய் டெவலப் பண்ணி அந்த ஃபார்மரை ஒரு என்டர்பிரனரா டெவலப் பண்ணியிருக்காரு. அதான் எக்ஸலண்டா அவர் பால்லாம் கலெக்ட் பண்ணி அந்த ஊர்ல இருந்து ஒரு என்டர்பிரனரா டெவலப் பண்ணியிருக்காரு. அவருக்கு ஃபீல்டு எப்படி எல்லாம் பண்றதுன்னு மொபைலைஸ் பண்ணி அவர் லிங்கேஜஸ் எல்லாம் ஏற்படுத்தி கொடுத்துருக்காரு. ரமேஷ் ஒரு பெஸ்ட் ரீடியேஷன் மட்டும் இல்ல, ஒரு குட் எக்ஸன்ஸ் ஒர்க்கர் ஆல்சோ. ஐ அப்ரிஷியேட் ஆல் ஆஃப் யூ those who have participated. இந்த ஞாயிற்றுக்கிழமையா இருந்தாலும் கூட இன்றைக்கு இத்தனை பேர் சில கலந்துக்கிட்டு இந்த நிகழ்ச்சியை சிறப்பித்த கால்நடை மருத்துவர்கள் அனைவருக்கும் நன்றி. வணக்கம்.
Thank you.